My name is Christopher Moore. I'm a primary care physician at Swedish.
My name is Julie Bartok, and I'm a family nurse practitioner for Swedish.
My name's Allison Wallen, and I'm a medical assistant.
I'm Masha. I'm a patient service coordinator.
I'm Whitney Hull, and I'm the clinic administrator for the Swedish Renton Primary Care Clinic.
There are a couple of areas of care at the Renton location. First of all, there's primary care. Primary care is the largest. And then there's the specialty clinic, where there are a number of specialists that come there maybe 1 or 2 days a week. So anything from cardiology to gastroenterology, OBGYN is eventually going to be there. So that will provide access to specialists on certain days of the week. And then there's a musculoskeletal clinic where we have our physiatrists and we have physical therapy, occupational therapy, which is a great resource for a lot of our Boeing patients who require that kind of care.
So the onstage offstage is a new idea to Swedish. Basically, all of our exam rooms have 2 doors, so patients enter through the hallway on one side of the door, and then through the other door is our offstage area. So that's where our physicians, our nurse practitioners, our medical assistants, our patient service coordinators all sit, and that's where the magic kind of happens.
We're all located in very close proximity to each other. All the PSCs, the MAs are within earshot with a regular talking voice. So there's no need to get up to find anyone at any given point, which saves a lot of time for the provider. And it allows us to bring everything to the patient on the onstage area. So again, we are all entering through the same door. There's no exiting of the patient to schedule an appointment, to have a lab draw, to have vitals taken. Everything is brought directly to the patient from the offstage area. It's very efficient. I think that the close proximity helps to physically eliminate barriers that then translate into mental barriers. So there is no mystery or secrecy of the provider's office.
The patient service coordinator would go in the room and go over any questions that the patient might have before leaving.
And I review instructions from the provider. And if there's any referrals that are placed for them, I kind of just inform them what's the process with that, and it just saves that time or that call, and the patients know exactly what they're to do when they leave that visit.
Appointments are scheduled in the office before they leave. Any lab work, any x-rays are done in the clinic, so they don't have to worry about that. And it's nice because we have the rotating specialty office right across the street, and we have MSK across the street. So if the patient needs that, it's easy to find, and we're more than happy to help them with that.
One of the things that we have done with the Swedish Renton Clinic is try to make it as accessible as possible to patients. So for the primary care clinic, we're open 7 days a week from 7 a.m. to 7 p.m.
For the patients, it's absolutely fantastic. We get so many good comments about how convenient it is to be able to be seen after work, which can be at 6:30 or first thing in the morning at 7 a.m. when virtually no other clinics are open at that time. Our weekend hours are getting very, very positive responses. People are shocked, blown away, and so happy that they can have a physical on a Saturday or a Sunday. They love it.
Working together, it definitely fosters more of a kind of family atmosphere. Like, we joke a lot, we laugh a lot. We just talk to each other during the day, and you feel like you're really connected.